Asthma, whilst hugely common, is a condition which is generally poorly understood. The typical symptoms involve attacks where the airways narrow and difficulties with exhaling air. The typical treatment is an inhaler, which contains drugs to suppress both the immune system and hormones, and encourage the airways to open up. Treatment is generally limited to that, yet all it can do is suppress the symptoms, in the short term, without understanding more deeply what is actually happening. If you were to take a more holistic perspective on asthma, you would ask what the function of asthma is, rather than seeing it as the body failing. And when we look deeper into what holistic factors are associated with asthma and asthma flare-ups, we can begin to understand what that function is. First of all, asthma attacks generally appear to have a trigger. This trigger varies significantly depending on the person. It can be more obvious factors like air pollution, smoking, or allergens, medical factors like an infection or drugs, or for some people, it can be emotional, such as fear, crying or laughing. However, those are just the triggers, and there is also the question of what causes someone to have asthma in the first place. Some will tell you it's genetic, but I think the evidence points to a different perspective. In people who have asthma, you often see chronic stress. Not just emotionally, but also in their hormone profiles. In fact, often the drug treatment for asthma is a corticosteroid, which actually just suppresses stress hormones. It can help in the short term, to temporarily stop the asthmatic response. However, in the long term, the problem is the individual has a chronically dysregulated amount of stress hormone levels. Oftentimes, it is that they have been so exposed to stress in the past, that their body has become too overwhelmed with the stress hormones. As a result, in stressful situations now, the body releases a weaker amount of stress hormones. In other words, their stress responses become suppressed. What then happens during asthma is when a trigger occurs, and the body becomes stressed because of it, releasing for example its immune reaction. The body won't release enough stress hormone to counteract that immune reaction. The individual then gets overwhelmed with an asthma attack. But, beyond just the impact of chronic stress on desensitizing our hormones, it can also overly sensitize the immune system. Chronic stress puts the immune system into panic mode, and it becomes overly sensitive to triggers. An asthmatic person will then react to even the slightest of triggers. So you end up with a body that is hyperreactive to triggers, but also incapable of controlling its excessive reactions. It is in a way, almost functional, because someone who is used to a stressful life, and undergoes another stressful trigger in the present moment, will be forced into taking a break and withdrawing from the triggers, due to their asthmatic symptoms. It forces our body into saying no to the trigger, when we haven't been listening to the messages so far. There is, for example, a strong association between the severity of asthma, and having difficult relationships with family or friends. As your asthma symptoms worsen, your body is forcing you to either cut off those toxic individuals, or gain more empathetic attention from them. However, the stress doesn't necessarily have to come from relationships. It could be from work, or even self-imposed, such as having a people-pleasing personality. When you have difficulty saying no to something, your asthma symptoms arise, and they say no for you. The relationship-related stress is particularly prevalent among asthmatic children. Children are much more dependent on others around them, especially their parents. And importantly, they haven't yet developed what we call differentiation, which is the ability for our emotions to be independent. If there is a breakdown in the relationship between parent and child, even as subtle as the parent being slightly distracted, the child will pick up on it. Some typical problems that can distress the child's body include the parents being overly dependent, intruding on personal boundaries, having weak boundaries, overprotectiveness or being controlling, rigidity, or a lack of conflict resolution. The worse the family environment is for the child, the worse their asthmatic symptoms tend to be. Some studies have shown that children with asthma have abnormal respiratory patterns when they listen to their mothers, and also that when they're frustrated, criticized, or recall anger or fear, their airways narrow. The less emotionally independent the child is, the greater the impact of this. Asthma is particularly common in children, perhaps because they are so dependent on the emotions and relationships of those around them. However, as we age, many people will grow out of their asthma. Some people won't though, and actually, these people with adult asthma often report that their childhood experiences are still affecting their adult life. For them, flare-ups of asthma come at times when strong emotions of fright, or repressed anger, from their childhood, are brought up. The typical asthma treatment where hormones are suppressed with drugs, on a short-term basis, would never be able to address asthma so deeply like this. Yet, it is important to do so if we want to thoroughly and truly treat it. So, if we have asthma, what should we actually be doing? First of all, remembering to see your asthma as functional, giving it compassion and understanding, rather than becoming frustrated with your body. Then, giving some attention to your levels of stress, especially any chronic stress you may have been ignoring. Perhaps, exploring what your symptoms and their timing may be telling you, what is your body telling you to avoid. But equally, it's important to just generally calm the body and the immune system. It has become hypersensitive, so what can you do to make it calm again? Perhaps things like a healthier diet, more exercise, meditation, or healthier relationships. One thing often reported by asthma patients that helps is drinking kefir, which is a drink rich in healthy gut bacteria. And once you have a healthy and calm body again, it is much more likely your body will recover.